Now, the Operation Dudula movement is the latest organisation to join the campaign at targeting undocumented foreigners seeking healthcare services at public hospitals like Addington and Durban. Dozens have already been turned away, including those on chronic treatment. Human rights groups have condemned the campaign, calling it unconstitutional and inhumane. Joining us is Dr. Vusumuzi Sibanda, Chairperson of the African Diaspora Network. Dr. Sibanda, thanks for your time today. Can you describe the scale and impact of what's happening on the ground right now at some of these public hospitals?
Thank you very much. Good afternoon and good afternoon to the viewers. Well, look, this is growing. I mean, it started maybe at a relatively smaller scale, but seeing what has happened, in other hospitals, including in Soshanguve and Durban, this is growing, and unless it is abated, because you can see that we've seen that happening initially in Gauteng, but now it is in Durban. And this shows that now it's becoming countrywide. We know that it has also happened at some stage in Polokwane, but now we can see that it's gaining traction unless, proper steps are taken to enforce the law and ensure that, these groups that are resorting to self-help and vigilante groups are obviously taken to task. This is going to grow and embolden other people that might think it is the correct thing to do.
Now, do you have an idea of the numbers of individuals that have been impacted or that are being impacted by this process?
Well, I mean, apart from the numbers that, obviously we get from various publications, but we have seen from video footages quite a lot of people being turned away. So, I mean, I might not really say that these are the numbers, but as a result, we have seen some of the, even some of the clinics where people would ordinarily go becoming very, very empty instead of actually having, people, attending, clinics. And we have seen in Soshanguve at some stage quite a good number of people in Atridge, a good number of people, tens of people being turned away. So the numbers is unconfirmed, but obviously it is clear that we've got probably thousands of people that have been turned away this far.
Now, the Constitution of South Africa protects access to healthcare. How is this campaign challenging that principle?
Well, this campaign is basically, to say, the list is unlawful, because it is unlawful in the sense that no one should interfere, with the rights of any other person. Immediately when a person interferes with the right of the other person, because the right to healthcare is enshrined and protected in the Constitution and in quite a number of international instruments that deal with, asylum seekers, refugees, and migrants, as it were. So you're looking at people that are stopping, not necessarily, people that they claim that they are undocumented, but they are stopping anyone who is, a migrant from accessing healthcare, which includes asylum seekers, that either are de jure or already, de facto, in the sense that some already have been declared to be refugees or asylum seekers. Some are yet to be because they are seeking and they have not yet been conferred the status. And you've got migrant workers that are working in the country with various documentation that permits them to be in the country. So stopping and interfering with the rights of these people is obviously unlawful, and it might lead to some people dying as a result of failing to access medication. And if this happens, then it means that those that are perpetuating these activities will have to be charged with murder, or culpable, homicide, at least some form of murder, because they will have led or caused the death of those people by preventing them from accessing healthcare. So indeed, in terms of the Constitution is very clear. International instruments are very clear. People that are doing this are violating the law.
So let's talk about these processes. I'm sure you've got hands or feet on the ground that are monitoring how this is working. What documentation are they requesting in particular, and how is this process being conducted, determining that certain individuals are illegal migrants?
Well, they're not even saying that you are illegal. They're just asking people, if you get are you South African? If you're not a South African, go back to your country. You can't access healthcare here. I mean, the footage that we have and reports that we've obviously, received is clearly one where the determination is based on whether you are South African or not. So if you are South African, and obviously you cannot, if they think that you're not a South African and they want you to produce, obviously documentation to prove that you're South African. If you can't, then, they prohibit you. And because of the history of xenophobic attacks and violence and how people have been embarrassed, as well as the fact that a lot of people, even in these hospitals or even in these schools, that should know that this cannot be done, they seem to be acquiescing somehow, or agreeing to these actions. If they had not been agreeing to this and encouraging or calling the police on them, this would not be continuing, because the issue basically is you are either South African, you are allowed. If you are not, then you're out. So the people cannot even protect you. You've heard some of them trying to protect it, but look, I'm entitled, I work here. I mean, I've got proper documented in the country. No, go back to your country and get, healthcare from your country. So it's not about just whether you are irregular in the country or regular. It's about whether you are South African or not.
Now, Dr. Sibanda, some argue that South Africa is overwhelmed. So what is a balanced way to address healthcare strain without resorting to any form of discrimination?
Well, look, I mean, the issue is that there is a law. The law is very clear that, people are entitled to healthcare depending on, the emergency, the level of emergency that is associated to the particular healthcare. People are invited to make payments. Migrants are supposed to pay when they go, to these hospitals, depending, as much as they may not be refused, but they are supposed to be billed so that at least they can pay. So those that can pay obviously pay. We've seen quite a lot of people that are attesting to the fact that they have paid for healthcare by merely, the fact that they are non-South Africans and migrants and they are willing to pay, but they live in South Africa and must access healthcare in South Africa. So as much as we talk about the fact that South Africa is overwhelmed by migrants, I think, true as it might be, the issue that we should be talking about is regularizing people that are irregular, so that at least it will allow government to plan. If you're talking about people that, are regular in the country, these people, the census, the statistics that the government needs, the government has got that statistics to plan for people in various areas according to these states. So there are people that are documented, that are known that they're within the country. When government plans, it should obviously include them in their plan, because they know for how long these people should be in the country.
I want to touch a little bit on government's response so far. Do you feel it's adequate? What sort of response have you experienced from government to this issue?
Well, government has not really responded. I mean, one would actually say that the government is complicit, for starters, because remember, unfortunately, it goes back to the fact that if we look at a lot of social unrest that has been taking place, within, communities, there are a number of cases where we have seen that the response, even from the police, where we have seen ordinary attacks, have not been adequate. The government itself, we've heard the president say, look, don't attack foreigners, but that just is not enough. What is required is the hand of the law to be seen to be strong on people that are practicing this discrimination, because it is against the National Action Plan. It is against the laws that deal with, equality and the Constitution. So people should be arrested and charged the same way that we saw in the Standard Bank case, where we saw, racism being, treated. So what we need to see happening is we need to see people being charged when they act outside the provisions of the law, particularly when they prevent other people from accessing either education, accessing, healthcare facilities, simply because they say that, they are not South African. So the government has not, and I mean, I'm not sure if it has anything to do with the fact that now it's even worse because we have got political parties that are in government that are right-wing, political parties that say, what, you must close out all migrants and kick them out of the country, like the Patriotic Alliance and Herman Mashaba's political party. So these kind of groupings have made this worse because they continue, as they are part of government as well, to, echo or say these sentiments, and they're even saying them loudly, and nobody's holding them to account.
Now, just final thoughts. You are chair of the African Diaspora Network. Have you had conversations with any of these groups to establish if there's a middle-of-the-road approach?
Well, we've had, it's been, quite a while. We've had quite a number of, discussions and debates, on these issues. And, a lot of them, speak from a point of, unfortunately, that is not lawful, a point of peer pressure and populism, where they tell you, look, we want to unite as Africans, but let us unite while these other people are back in their countries, not in South Africa. So it is an extreme, right position that says we just want to close South Africa and fix South Africa. South Africa has got lots of problems, so we want to fix our problems on our own without any migrants, and let these other migrants, even if they are from Africa, go back to their countries. We're going to talk and try to fix Africa, with them while they are back in their countries. So there is no middle of the ground. It's either, if you're not South African, you must just leave South Africa.
And finally, just walk us through the conversations that you've had with some of the individuals that you represent who've obviously been deprived of medical treatment.
Well, the people that we've had, some of them, will tell you that, look, they've got chronic illnesses. Some of them have been lived in the country. They work in the country. They are lawful in the country. Some of them will tell you they've got conditions like, HIV, positive, and they want, somebody was saying, look, I'm supposed to go and collect my medication. I mean, for the first time now, I've been prevented. I cannot do that. And some people tell you, look, we've been going for dialysis, to the hospital. We've been here as asylum seekers for over 20 years, but now, we're being prevented. We cannot go in there. Our documentation is in order, and we cannot go back to, our countries because there is war and we're at risk of death. So you understand, and this then, exacerbates, or basically resonates with the call that we have seen, with a lot of asylum seekers starting from 2019 that have been saying, look, unfortunately, they have not been treated fairly. It might be better if, the United Nations, worked hand in hand with South Africa to get them to a third country because their rights are not protected here. I mean, you'll remember the Bergville, situation in Cape Town, which is basically coming from this particular, kind of scenario. So the bulk, a lot of these people that we have, are people that need urgent medical attention, and they cannot access it because, somebody's standing in their way, and hospital, management, is standing back, and they're not doing anything. They're not even, they stand and watch and even shoot videos and laugh with the people that are doing this thing instead of, inviting the police, to stop the disruption that is taking place.
Dr. Vusumuzi Sibanda is chairperson of the African Diaspora Network and speaking to us on a movement, the Dudula movement, that is preventing both legal and illegal immigrants from accessing healthcare facilities in certain parts of the country.